So we started with clinical self-breast examination, then clinical examination, then we went on to advising women to do a mammography, and that too not by conventional mammography but digital mammography with tomosynthesis. The reason being, this is much more sensitive. This tomosynthesis machine gives a 50% better sensitivity to mammography. So you'll ask me, what is the sensitivity of conventional mammography in especially young women with dense breasts? It is around 30%. That means 70% of cancers will be missed. However, if the same mammography is carried out on a digital machine with tomosynthesis, the sensitivity, that is the ability to detect the cancer, goes up by about 45 to 50%. So it will go up to 75%. So we still have a lag here. So what do? We combine at our center with ultrasound, and an ultrasound of a very high quality again. There are ultrasounds and ultrasounds and ultrasounds in the world, but for breast diagnosis you need a very high resolution ultrasound imaging with elastography to help us in diagnosing early breast cancer. Ultrasound per se increases the sensitivity of imaging when you add it to mammography by another 15 or even up to 20% with the machine that we use at Orchids. The ultrasound that we use is an automated breast ultrasound, wherein there is no doctor or technician actually holding the probe and doing an ultrasound on the breast, but the machine does it on its own with the help of a scanner, and you get a 3D and a 4D image of the breast as shown in this picture. You will realize that a smallest of tumor there is easily picked up on the background of dense breast tissue, and that tumor can be easily diagnosed, which may be missed on a mammogram. The sensitivity of this adds 20% sensitivity to imaging of the breast, and therefore with a combination of breast mammography with tomosynthesis followed by a automated breast ultrasound or a handheld ultrasound by a trained radiologist increases the chance that early breast cancer will be picked up and reduces the possibility of missing a small lesion or a small cancer. This is a mammogram which is normal. That means there is no suspicious shadow in the X-ray. However, if there is a suspicious lesion or a shadow, it may look like one of these, and you will see that these shadows are very typical of a lesion which is most likely a malignancy. It's a brush border, it's calcification, it's a speculated density. These are technical terms you need not know, but these are the pictures that are looked for by an experienced radiologist, or on the ultrasound and on the ABVS. These are the sort of shadows that we see during our examination of the breast.